All right, let's talk about something that can quite literally prevent cancer before it even starts. We're diving into colorectal cancer screening. And look, I know it's not exactly a glamorous topic, but really understanding your options, that knowledge can save your life. So let's break down exactly what you need to know. So, why is this such a big deal? Well, take a look at this number. About 5% of people in the US will be diagnosed with colorectal cancer in their lifetime. That's 1 in 20. Think about it, your family, your friends, the people you work with. That's a pretty significant number. But here's the thing, the most important part. It is one of the most preventable cancers out there. Okay, so if it's so preventable, what's the secret? What's the magic trick? It all comes down to screening. And I'm not just talking about screening to catch cancer early. We're talking about screening to stop it from ever getting started in the first place. And this is why screening is such a game changer. You see, most colorectal cancers don't just pop up out of nowhere. They almost always start as these little precancerous growths called adenomatous polyps. The real power of screening is finding these polyps and getting them out of there, often during the very same procedure, which completely stops them on their path to becoming cancer. It's an amazing opportunity. So where do you begin? It all starts with you. Seriously, screening is not a one-size-fits-all deal. The right plan for you depends entirely on your own personal health and, really importantly, your family's health history. All of that together determines your personal level of risk. Generally speaking, we all fall into one of two buckets. You're considered average risk if you don't have any major personal or family history of colon cancer or those polyps we just talked about. On the other hand, you're at increased risk if you do have that history. Say a close relative had it, or if you have certain medical conditions, like inflammatory bowel disease. Knowing which group you're in, that's step one. And that risk level directly tells you when you should start thinking about this. For folks at average risk, the American Cancer Society now says to start at age 45, though some other groups still say 50. But, and this is key, for anyone at increased risk, that timeline gets moved up. Screening often starts at age 40 and sometimes even earlier than that. Now, for people with a close family connection, there's a very specific rule of thumb. If your mom, dad, a sibling, or one of your kids was diagnosed, you need to start screening at age 40 or 10 years before the age they were diagnosed, whichever of those comes first. That is such a clear, actionable rule you absolutely need to know. Okay, so once you know when to start, you have to figure out how. And it can seem like there are a million different options, which can be overwhelming, but you can really boil it all down to two main paths. You've got your stool-based tests. These are the non-invasive ones you do at home that look for signs of cancer. And then you have your direct visualization tests. These are actual procedures where a doctor can look inside your colon to find and remove polyps. So let's see how these actually stack up. First up, the stool tests. There's the FIT test, which you do every year at home. Super easy, no prep. Cologuard is another one, also no prep, but you do it every 3 years. Then you have the visualization tests. Colonoscopy is the big one. It requires a prep, but if everything's normal, you're good for 10 years. And it can find and remove polyps all in one shot. And then there's CT colonography, kind of like a virtual colonoscopy, which also needs prep. It is done every 5 years. Now, this is a really, really crucial point. You have to understand how these tests work together. If you choose one of those at-home stool tests and it comes back positive, that is not a cancer diagnosis. It's just a signal. It means you need to get a follow-up colonoscopy, so a doctor can take a direct look and see what's really going on. Think of the stool test as the first alert, and the colonoscopy is the full investigation. You know, with all these choices, it is so easy to get stuck in analysis paralysis, right? Just overthinking it and never making a choice. But I want you to remember this quote. It's a famous saying in public health for a very good reason. Don't worry about finding the one single perfect test. The most important thing, the best thing you can do is just talk to your doctor, pick a test that works for you, and actually get it done. So what happens after you've done the test? Well, if the results are normal and no polyps are found, that is fantastic news. You're typically all set for another 5 to 10 years. Now, if polyps are found, they're removed and sent off to a lab. A pathologist takes a look and figures out what type they are, and that's what determines your own personal follow-up schedule. And here's kind of how that personalized plan works. For example, if they find just 1 or 2 tiny, low-risk polyps, you probably won't need another screening for a good 5 to 10 years. But if a higher risk polyp is found, your doctor is going to want to see you back sooner, maybe in 3 years. The more significant the findings, the shorter the time until your next check-in. Your plan is totally tailored to you.
So, what's the big takeaway from all of this? Here is your super simple 3-step action plan. Step 1, know your family history. Seriously, make the calls. Ask your relatives about colon cancer and polyps. Step 2, take that info and talk to your doctor. Have a real conversation about your personal risk and which test makes the most sense for you. And finally, step 3, make a plan. Choose a test and get it on the calendar.
Because at the end of the day, this isn't just about learning facts, it's about taking control of your own health. You now have the knowledge, you know the tools that are out there, and you've got a clear action plan. So the only question left is the one right here on the screen. What's your next step going to be?